All right, let's go ahead and get started. So everyone, welcome to the 7th annual International Conference for Spirituality and Psychology. My name is Lynn Howard. I will be your primary moderator today, and I'm very excited about this panel discussion. This panel discussion is Healing Methods, Traditional, Scientific, and Self-Healing. And we have a great lineup of panelists, so please give them all a warm welcome, either in the chat in the Facebook group, if you're tuning in our Facebook group, or in the Whova app, which is a platform that we use for our conferences until next year, because we're done doing virtual conferences and we're going back live, everyone. Okay, first, let me welcome Krista Nelson. Krista Nelson is a single mother of 5 residing in Philadelphia, Pennsylvania, and on ancestral Lenape. Did I say that right?
Yeah. Lenape.
Good. I don't know what it's been. I've been very tongue-tied lately. So, as a shamanic practitioner known as the iridescent moon, a silver lining sentinel, Krista specializes in helping people cultivate intimate relationships with nature. Please welcome Krista. Thank you, Krista.
Thank you so much.
Welcome. Azaad Kassam. Dr. Kassam is a cultural psychiatrist with an interest in spirituality and mental health. He works with severe and persistent mental illness, consults with refugees at the Ottawa Newcomer Healthcare Center, as well as with Indigenous communities in Eastern and Northern Ontario. He's involved in migrant and cultural mental health research, enjoys teaching transcultural psychiatry, and maintains assistant professorship with the University of Ottawa, as well as Northern Ontario School of Medicine. Please welcome Azaad.
Everyone.
All right, then we have Dr. Jackie Linder, and she's a longtime Tomorrow People org person, and we love her. She's also out of Canada. She's a Canadian psychologist, specializing in the treatment of trauma-related disorders. As Director of Canada Counseling Programs, Jackie oversees the strategic development of the Master of Counseling Programs in Edmonton, Calgary, Victoria, and Vancouver. She's worked at the university since 2007 with many roles. She does extensive work nationally and internationally in the area of human trafficking and founded North America's first mental health hotline for survivors of human trafficking in 2010. Please welcome Jackie. Jackie, yay. And then Lynn Martell is out of North Dakota. She is a member of the Turtle Mountain Band of Chippewa Indians. I did say that correctly, correct, Lynn? Good. She grew up in a rural reservation in North Dakota where she learned traditional practices as well as values. In 2016, Lynn obtained her BS, her Bachelor of Science in Psychology and American Indian Studies. She's now pursuing a PhD in clinical psychology at the University of North Dakota and is a member of the Indians into Psychology Doctoral Education Program. Please welcome Lynn. Excellent. All right, so let's go ahead and get started. And the first question I'm going to ask, and pretty much for everybody who's tuning in, the way that this panel goes is we ask everybody a question. They have about 3 minutes to answer each question, and it's a 90-minute session. So please, if you have any questions, if you're on the Whova app, you can throw them into the Whova comments and we'll try to ask them. If you're tuning in from Facebook Live, please put them in there. All of our panelists have been suggested to go back into the Facebook Live at a later date and go ahead and make comments, engage with you then. So please make sure that you're connecting with them, especially if something that they say resonates with you. So let's go ahead and get started. The first thing I want to ask is why did you say yes to this panel? Like, what makes you excited about it, or what's the connection to it? And I'm going to start with you, Azaad.
Sure. Thank you. Azaad Kassam again from the land of the Algonquin peoples in Ottawa, Canada. I think what excited me about this was first of all, connection and a chance. I mean, this came through Vlad and through Dr. Khalid Bazaid, my colleague here, who I've had discussions with and teach with over the past several years, but it was an exciting opportunity to dive into things that in psychiatry have been quite marginalized, and that includes aspects of culture and spirituality. You know, there's a tension in psychiatry around, you know, how do we view health, and how do we view mental health, and so the types of approaches that are more holistic and incorporate multiple ways of viewing things tend to be pushed to the side. So even in places where aspects of social psychiatry and culture have a lot of work and a lot of research being done. For example, places like McGill, where I trained many years ago, and influenced my practice certainly. Even in those departments, the areas of cultural psychiatry are marginalized within the department, and have been for many years, even though they're quite internationally recognized. So I think this is a nice opportunity to bring different people together, I'm seeing so many different disciplines and points of view coming together, and to really sort of embrace pluralism and talk about things we might not normally talk about in clinical medicine in particular. So that's really what gets me excited about being here today.
Excellent. Thank you, Azaad. How about you, Krista?
Oh, thanks for asking. And I agree with so much that Azaad has already said. I'm personally encouraged by the opportunity to discuss healing methods in general at a time when there's such great need. But even more importantly, there's a growing expectation to experience healing, I'm finding. There's a rise in the expectation of equanimity and justice and understanding. I'm in a lot of virtual arenas where people are talking about connection and making a contribution. I'm personally interested in how the areas of traditional and indigenous, scientific and self-derived healing methods differ and where they intersect, right? At the point of intersection, there's like a party, right? Because we're like getting it from all different facets and angles, and it's all good news, right? It's all a way to help people and to help ourselves and help the planet. Some of my ancestors are Lenape, Native Americans who lived close to where I live today. Like I live on Lenape land here in what's colonially known as Philadelphia, more specifically in the Wissahickon Valley Park, which is really very beautiful. I'm studying the language of the Lenape, which is now my language. I'm now a member of the Lenape Nation. And with learning the language, I'm also learning about the culture and healing methods. However, like in addition to that, as mother of 5 children and 2 grandchildren with a 3rd on the way, I have respect for and familiar with scientific healing methods, right? So self-healing is empowering and it's supportive of the other 2. So I'm excited about being here in this conference and getting to know more about all 3 areas of healing, for all the reasons that I've mentioned. It's so good to be here. Thank you.
Excellent. Welcome, Krista. How about you, Lynn?
Hi, thank you so much for asking. I think for me, I was really excited about the opportunity to get to speak about traditional practice as well as self-healing, because a lot of times we tend to rely on the scientific approach, and learning that doesn't have to be one way, that it can also be a collaborative approach among the 3.
Mm-hmm.
Absolutely. Thank you, Lynn. Jackie.
So I think you know that I was thrilled to be invited to the panel. I just want to say hi from Trudy 4, 6, 7, and 8 lands out west here in Alberta, which is the Texas of Canada, for any of you who are in North America. So my interest actually in this panel and holistic healing methods actually stems from 30 years ago when I began my own recovery from trauma. And it's been a very, 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 very long journey in which I have done all the modalities. But in Western psychology, so my first degree is in anthropology and my next 3 degrees are in psych. Western psychology has really missed out on an amazing toolbox in terms of holistic healing modalities, which we, loosely call complementary healing. I'm not sure that is complementary healing. I think cognitive behavioral therapy might be the complementary healing. Certainly in terms of the ancient healing technologies of our First Nations and Indigenous people, there's lots and lots and lots and lots there. And this is an opportunity to talk about how we integrate those things. It's sort of all hands to the pump in the world of trauma, particularly complex trauma. Certainly in the times we're living in, we're going to need every healing tool that anybody has found successful for anyone, because no intervention works for all individuals. So this is a chance for me to expand my own knowledge and share some of my knowledge in this area.
Absolutely. Thank you, panelists. I was telling the Vlads earlier today that this panel is probably one of the ones that I'm the most excited about, especially for this conference, just because everything that all of you said, the interconnectivity of all of them that could be, and when we really can see the benefit of all and move forward with that with the right knowledge, I mean, we really can take our own healing into our own hands and be able to regulate that and to maneuver that and guide that in a way that is powerful for us and the people around us. So I appreciate you all being here. Very excited about that. All right, so the next question is, what made you, so we're going to get a little personal, what made you enter into your healing practice? I'm going to go back to you, Jackie, because you started that you got into it because of trauma, but if you'd like to share either a personal story and or just more factual, that's up to you, panelists. But I am going to go around the room and also let everybody know, is it more traditional? Is it more scientific? Is it more self-healing? Is it a combination, and why?
Well, I'll tell you how I started out. So I, thank heaven, started therapy when I was 14 years old. I'm 50 years old now. And it was very family oriented, delicious stuff. I got a lot out of it. And then I sort of, fell back into life and doing day-to-day living, returned to therapy in my late teens. It was very CBT Adlerian oriented, great stuff. After 2 years, I informed my therapist that I was done. I was healed. I'm good. Thanks for all you've given me. To which he replied, I have this friend who's into this other thing. Why don't you go meet her? So I did. 7 years later, 7 consistent years of work with her later, I'm now 9 years into the process, I thought I'll take a break. In that second set, the modality of 7 years, that is when I discovered shamanic practices as a healing method. And it's actually why I went back to university in the end and did my first degree in anthropology. I was fascinated by what I learned there. And I have returned to shamanic practice throughout my healing process over the last 30 years. I would not be where I am in my life today without the psycho-spiritual healing layer. I am crystal clear that CBT is very important, that the body work is very important. It's all important. But in the traditional teachings, you have to think about the mind, you got to think about the body, you think about your relationships, your spirit, your soul, your heart, all of these pieces. And each of the technologies that we currently have in both what I like to think of as the allopathic and the homeopathic, or the holistic, the traditional and the classic, is skilled at a particular thing. If all you have is a hammer, then everything's going to look like a nail. And where we really miss the boat in terms of Western psychotherapy, regardless of your license, is this layer underneath the mind, what I like to call the ontological layer. And anybody who's experienced complex trauma knows that there is more that's sort of not working for me than the talk hour, the 50-minute hour that I walked out of my therapist's office, that was great, but I'm not done. Well, why aren't we done? How come we can go to talk therapy for a decade and not be done? The answer is because there is also psychospiritual injury and trauma that is not being attended to with the classic Western approaches.
Absolutely. Absolutely, Jackie. Thank you. Lynn, how about you? What made you enter into your healing practice? And what aspects do you use?
Yeah, I think for me, I really joined the healing path after I attended the Indians in Psychology Doctoral Education Summer Institute program. I think I was like in 11th grade, so I started this journey a long time ago already. And when I attended the Summer Institute, I learned about the shortage of people that practiced on American Indian reservations, as well as those that had that knowledge and competency to incorporate those traditional practices on those areas. And growing up on the reservation, I witnessed a lot of the firsthand effects of mental illness across the community, and seeing that, you know, there's this high need for that gap to be bridged between those that have the knowledge and have that understanding, and the need is there for that mental health to be treated through those traditional practices. And I think a lot of times, thinking back on our cultural beliefs, and each tribe has their own cultural beliefs, but thinking back, that healing has always been a part of our culture for generations and generations, and that's something that's been effective. So if it's been effective, we don't have to change the wheel. We just have to recognize the importance of that being effective, and how can we, you know, take that and also use it through that scientific lens that so many of us are taught in our college studies.
Excellent. Thank you. Thank you. Thank you. Krista, how about you?
Okay, wow, so fascinating to find out how people got started on their path. My healing practice is more self-healing. And I would say that from a very young age, I had many of the attributes that would lend themselves to a practice of self-healing, like a willingness to listen, joy in working with others to solve problems, basic curiosity, right, patience, and an awareness of how being in nature lifted my spirits and the spirits of those around me. Like when I would go to the woods with my brother and my sisters, like just how great we would feel, and how like all the chatter in my mind would quiet, you know. But when I was 17 years old, my father died suddenly. It was late at night. He suffered heart failure. And my mother and I were with him at the time, and it was a shock, right, as you can imagine. And while neighbors came to comfort my mother, there was a moment when I was alone. I found myself alone, and I felt as if I was like in a dream state, right? And none of this could be real. And in that state, I went outside. It was a very warm night. I think I would have gone out in any weather. Like I just wasn't, I felt like I was out of my body, just sort of like moving, you know, moving through space. It was the sanctuary of the night, of darkness, you know, and of being outside. This cloak of like velvety darkness was comforting. And alone there in the dark, I was aware of a breeze moving through and through the trees and across my skin. I could hear the wind in the trees, and I felt in that moment that the wind was there for me. Like this was a personal connection that was being made, and that the wind was keeping me company, right, and sort of talking with me. I felt that I wasn't alone, and I was like embraced by air. And this moment buoyed me at a time when I could have really fallen into deep despair. And like, how was it at this like terrible moment, the death of my father, how could I like be connecting with such sweetness? Like this is like, you know, the moment that I was in and I could reflect on for like years and years after. And the company of the wind came exactly at the right time. I carried this awareness with me, and it helped me to endure that loss, where I could, you know, I could then be strong for my mother and other people in my family. So this is like, you know, going way back, and just wrap it up quickly, like how it wove its way into like feeling that nature elements were healing and that we could just connect with them and help, heal ourselves. Yeah, I can say more about this later in chats if anyone's interested.
Wow, beautiful. Thank you, Krista. And Azaad, how about you?
Yeah, thank you for that, Krista. I'm very touched by your words, as many people are, I think, right now. I think psychiatry chose me. I tried really hard to resist it. And I knew at some point when I was in high school, early university, when I knew everything and told my parents that I knew more than them, and this is what I'm experiencing now with my teenagers, and I had this draw toward medicine, but when I was in medicine, I resisted psychiatry as much as I possibly could. Like many colleagues, I think, but eventually it drew me in, and the answer is still evolving. I didn't choose. I'm still choosing the path that I'm on, and it's taken many turns along the way for me to start in delving more into spirituality and culture. And when I look back, I realize, and I never realized this before, but somehow subconsciously, it does go back to early life. My grandmother was a spiritual healer. It was just how we grew up. I never really thought about it. It's just when we were sick, we went to her for healing. That was a very normal thing. And I think along the way, I entered the material world and then the scientific and biological world and kind of pushed that aside. But it seems to have bubbled up in a way to start that connection. And I think through seeing patients, and I mostly treat severe and persistent mental illness or acute psychiatric conditions, but just seeing many people, I've seen, as has been referred to already by others, that the limitations of Western medicine and psychology, and some of the very key touch points with a person that really opens them up, and really you can feel their healing beginning, and it's usually generated from within themselves. And I've just started to see that at various settings, and I think that that's how I've started to really take to that, and hope to continue to develop that. Thank you.
No, thank you, Azaad. All right, so now that we know a little bit about all of you and your root and your why, a little bit, just a smidge, I want to, especially for those that are maybe tuning in on Facebook who might not be as aware of, we'll say, for lack of better terminology, the definitions or how to understand what the differences are between the healing methods. And I heard a couple of you call them different things. Jackie, I remember you called them other names, but because the panel name is traditional, scientific, and self-healing, could we maybe go around the room real quick? And it might not be a long answer, and that's okay, but to just help define these for those that are listening, and maybe give some different aspects that separate them all from each other, or even the importance. So you can go either route or both routes. I'm going to come to you first, Krista. So if you can help define them, or you don't even have to define them all, you can define one or two.
Thanks. I guess what I think of when it comes to self-healing is what a person can do for themselves, right? Where they don't really have to consult with an expert, a healing expert, but what you can do, what anyone can do for themselves, right? Self-care, we're talking there, like self-love, right? Like really, for me, it's like really easy touch points at any time of the day and for any kind of situation. So if it's a relationship needs healing, or a health issue needs healing, or work, what I found as a life coach was that creating change worked best when people felt good. right? So, and I was thinking about like, you know, what makes people feel good. And with my clients, we get informed by the people we work with, being in nature made them feel good, right? If people felt good in nature. So this became what my sort of definition of like self-healing. How can people feel good on their own? And that's like, you know, that's a baseline. And for me, when I think of scientific, I think of, you know, the respect for people who study the sciences, right? And come with a wealth of knowledge from an academic approach, right, and from practical, you know, practice. And when I think of traditional, I think of ancestral practices. You know, what's in our cultures, what's in our history, what's in our lineage, natural medicines, ritual, ceremony. That's where that takes me. I'm interested to hear what others how others define these three.
Absolutely. Thank you, Krista. I'm going to come back to you, Azaad.
Thank you. I have no clear definitions for these, but if I reflect on them, I think in practice they all happen simultaneously. You know, so certainly in the type of training that I underwent, and the indoctrination was to be scientific, you know, and so to rely on certain methods of evidence and so forth. But the question comes in is like, whose science and whose evidence? And there's a strong sort of colonial kind of underlay to the science we do, and how we you know, communicate it, how we publish it. You know, and so, you know, can we look at indigenous science, for example, as another source of knowledge? And so, is that scientific or is it traditional? And who's deciding what is scientific and what is traditional? In practice, I find, you know, and I work in a very sort of practical environment. People combine these things all the time, whether we like it or not. And I think that's for good reason. I think people understand that, you know, there's more to their mind body than what I can offer from the science that I bring. And so if I, you know, if I close myself off to that, I'm missing a significant opportunity to support somebody in that. And again, I think as Krista said, the, you know, self-healing for me again is part and parcel of what people do. And sometimes, you know, mostly what I'm doing is helping them to engage with that. You know, there's a lot of things in psychiatry, but in medicine overall, you know, we sort of are trained to think that we can control the body and that we can cure things and so forth. But, you know, that this is, for the most part, untrue. For the most part, we provide we can provide a supportive environment for healing to occur. And, you know, one thing that I came across that has really stuck with me in looking at some of the teachings of Indigenous peoples is that all healing is spiritual. So again, whether I consider it that or not, that is really the truth of the matter. Thank you.
Thank you, Azaad. How about you, Jackie?
Well, I find examples always helpful because I'm a visual thinker. So I'll give you 3 examples of these technologies in my own life. Last summer, I was really, after over a year and a half of COVID, really struggling with anger, frustration, rage, outrage, bunch of stuff. So I tracked down a psychotherapist, psychiatrist, decided I wanted to work with some masculine energy, and spent the summer doing cognitive behavioral therapy. Very evidence-based, scientific, beautiful stuff. We made a lot of progress for the first 10 sessions. Then the 11th and the 12th session, I walked away feeling worse than when I arrived. And I just so happened to be in a training program with Bessel van der Kolk at the time, and he was lecturing, and he said something to the effect of, the hardest thing for a client to do is know when that phase of therapy is done and say, thank you, goodbye. So I chewed on it and chewed on it. And I left a Dear John message from my therapist saying, you know, we're at the end. Thank you so much for all you have offered. I am now going to explore another modality. So then in November, I started working with an Indigenous elder. So we don't sit in a chair like I did with my face-to-face psychiatrist, you know, very distant, very, you know, traditional, sort of patriarchal traditional. We always open our meetings with prayer and drumming. We've done that over 30 times so far. Much more heart-centered, traditional, two people on a journey, not me as a bug under a microscope, which is how I was starting to feel by session 11, 12 of that evidence-based modality. Last night, I left our meeting very, very moved by everything that I'd heard, but I was in a lot of pain. And so I sat in my yoga room, which is where playtime happens for me and my 6 cats. And I have an altar that has many kinds of rattles on it. And I had the presence of mind to sit on I stopped playing with the cats to their horror. And I picked up a rattle and I started rattling right over my heart. And the tears started to come. This is self-healing. And in that moment, I said to myself, this is heartbreak. And I am present. I can hold this. So in my experience, I have needed all of the modalities, the scientific, the traditional, and the self-healing. And I think I will continue to need them as I move forward.
Love that, Jackie. I adore you. Thank you for sharing the stories. And Lynn, how about you?
And I think for me, when I think of self-healing, I think of this concept that was taught to me by one of our elders, and that the individuals that come to see us, they're the experts of themselves, and we're just there as the guide, and really understanding that, you know, every person that comes to you has their own self-healing method that they've been doing throughout their own life, and helping them identify that, like, hey, that is a self-healing method that you have been using, and that is important for your healing process, as well as being able to really find intricate ways to use that in their everyday, like, moving forward. I think when I think of scientific, I think of the evidence-based practices that are really like heavily emphasized throughout your graduate courses, and also, you know, throughout your whole career. You know, everyone wants to make sure that you're using best practices, but also understanding that that isn't a one size fits all for every person. When I think of traditional, I kind of agree with what's already been said, is that that really goes back to customs and spirituality and beliefs that individual practices. And again, traditional can vary across people, and it's also important to think of traditionalism as varying across different age groups as well.
Excellent. Thank you, Lynn. Oh, love these answers. So a few of you touched on spirituality, so I actually want to pose this question now. I mean, this is the Spirituality and Psychology Conference. And so one of the questions that came up was, how do we understand the spirituality aspect, and how does it impact our healing practice? And I'd like, for those of you who want to take on the challenge, I'm a very, like, I love, like, what to do type of thing. So if you actually have, like, how someone could possibly, a how-to comment of how someone could start to understand the spirituality aspect of them and integrate it integrate it into their healing practice, even better. But I'll ask that question again. So, and I'm going to come back to you first, Lynn. How do you understand spirituality and how it impacts your healing process?
I think for me, spirituality that's such a broad term, and really helping the individual understand, like, what is their spirituality, and really helping them have a good understand, like, what a good sense of how much they identify spiritually, because we can't assume that just because they practice spiritual beliefs that they have a certain level of spiritual beliefs that they're practicing. And I think it's also important, depending on if you're, practicing with different communities, because each community can have its own belief system. It's really important. What I found, like, practically, is just, if I'm not from that certain community, is going out and seeking elders within the community or spiritual leaders within that community, and really getting their guidance on ways that we can incorporate different spiritual aspects into practice, and how important those are for that specific tribal community's beliefs, and also how can we use that moving forward. And for sometimes it's also been helpful to have them be a part of the treatment process as well, and getting them involved throughout the whole process, and not just as kind of that consultation piece.
Excellent. Thank you, Lynn. How about you, Jackie?
So I think what spirituality brings to the table is it gets us to the ontological layer of human suffering, or in my work, trauma. Suffering is way bigger than just the stuff you feel. It's bigger than how your pain changes the way you see the world. It is like, I no longer know my own essence in contact with whatever I'm seeing. And I don't know of any intervention except a spiritual one that can get to that layer of injury. So I always ask my clients, do you have a faith of any kind? I have Muslim clients, I have Druze clients, I have Christian clients, Jews, you name it, I'm in. What do you got? Because, and I say to them, if you don't have a God, I'm going to need you to go borrow one, rent one, or download one from the internet, because we're going to need a God up in here before we are done. That's how dark some layers of suffering can be. And I believe, regardless of, existentially, whether you think there's a deity and whatever your deity looks like, if you have contact with anything that is greater than you, that can help you hold the level of human suffering and trauma and help you move through it. Yesterday, after this conference, I promptly downloaded the Serenity Prayer, and I'm not actually fully a practicing Christian. Nevertheless, I got on the internet, downloaded the Serenity Prayer, and it is now taped on my refrigerator. I need to see it. I'm using it as a mantra right now. I need to reflect on it. I need to have it in my bones. I need to breathe through it. And that then gives me one more kilometer of gas, fuel on this journey of human suffering that I'm currently walking on.
Oh, thank you, Jackie. And absolutely, that stuck with me after yesterday's panel. So for those of you who did not tune into yesterday's panel, you definitely should take a look on the Facebook page. It will still be on there. And one of our panelists referenced the Serenity Prayer to help me, Jackie. My mind all of a sudden went blank.
Well, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference.
And what was he connecting that to?
The idea that if you can hold on to that prayer as an ongoing resource and a mantra, it's a form of self-soothing and grounding that can help someone who's feeling very anxious or distressed.
Yeah, even if you aren't necessarily religious in that sense. So it was a really great moment. So thank you, Jackie. How about you, Azaad?
Yeah, maybe just to pick up on something that Jackie said, that, as you were talking, you reminded me of patients who have been suicidal. I deal a lot, of course, with people who have attempted suicide or are thinking about suicide. And, I think at the heart of that is what you mentioned, which is psycho-spiritual injury, if I'm capturing that term correctly. It's really the hurting of the soul. And that, again, something I've sort of seen through experience of seeing people over and over again, and asking them, what is it that happens when you have been at that point of life where it is no longer fathomable to exist, and the doors have completely closed, and there's you can't see anything. And I think the important thing there is that connection, and it is about connection and about in the healing space being present with my client, and fundamentally recognizing that we are equal human beings, that I'm not a superior being because I'm in a position of power. The First Nations mental health continuum framework in Canada talks about 4 concepts at the center of healing, and those are hope, meaning, purpose, and belonging. Hope, meaning, purpose, and belonging. And I've utilized those 4 concepts with many people, and I also like those because they're a good starting point when I'm trying to teach, when I'm teaching students or psychiatry residents how to engage with this. There's so much that they have to learn, and it seems overwhelming, and so that's a good place to begin for them to think about. And I talked about this a bit yesterday, but I had a patient a refugee who came in with severe trauma, had lost a child, had witnessed her child die, then was in the ocean, saw another child drowning in front of her while she's floating, having capsized on her way out of Syria. But she had hope, and it was about finding meaning in what this is all about, having a purpose with her children, and very importantly, finding a sense of belonging and acceptance in her new land. So that's for me a starting point of working with spirituality.
Thank you, Azaad. Very, thank you. Krista, how about you?
Yeah, thank you. There certainly are profound levels of suffering, right? In the dark night of the soul, and despair, and then hope, meaning, and belonging being a light in that moment, a way of discovering a way beyond. So spirituality for me, as I understand it, is personal. It is a process of self-discovery beyond the mind and the body, right? It has to do with a quest to answer the question, who am I? And where did I come from? What is my purpose? What am I here to do? And why does any of that matter? That's what comes to me when I think of spirituality, and how that impacts healing is like seeing spirituality as a transformative process along the journey of asking questions and finding answers to those questions about the self. I think that in this, there you have the process of healing. The self-discovery may be seen as a form of healing, especially now when we're looking at generational and ancestral healing, which is all very new to me, but it's like, wow, this is like really incredible stuff, like healing deep trauma that, you weren't even previously aware of. And perhaps in this light, we could say that spirituality is a process of self-discovery, or a doorway to self-healing. In my grief processing support work, I encourage clients to experience loss, to remember a time when they may have played what we call dress up, like putting on like as a child, you might have put on the shoes or hats of your aunties or uncles or grandparents, and looking at these items and playing with these items, like going back to that time and making a connection with loved ones who are no longer with us, and using that as a spiritual connection. And I ask them to feel the comfort of these items on their bodies. And the same can be done by looking at artifacts like a pocket watch, or, a piece of furniture, or, inanimate objects that then bring on the emotions, and books, quilts, or dishes, like looking at old photos is another way. And the idea is to look back and feel a spiritual and emotional connection. And then I ask them to recognize that the people who came before them also experienced loss. And I invite them to feel comforted in sharing their feelings of loss with their ancestors and being held in a spiritual field of loving awareness. And so, you know, this is the spiritual field that is part of self-discovery, and I always hope is very healing.
Oh, thank you, all of you. I have so many comments. I need to just connect with you on one-to-one basis, all of you, because those were all beautiful. Thank you. Let's talk a little bit about, a few of you had mentioned about elders or community, and let's talk about the importance of what we can learn from our community and our elders. And you can take either aspect, so the community or the elder aspect, and whichever healing method or modality, traditional, scientific, or self-healing. So I'll leave that up to you. But I feel like there's profound things that we can learn. And Krista, even you talking about the ancestral healing, which I've done a lot in my own, like stuff that I brought or carry that wasn't even mine, right? And so that's more the spiritual side. With that being said, there's so much, even if they're no longer here, that we can learn from those that came before us or community around us when it comes to healing methods. So let's go around the room and yeah, what do you feel, either a good lesson or maybe a lesson that maybe didn't go so well, that we can learn from our elders or our community when it comes to our healing methods, either traditional, scientific, or self-healing? And Jackie, I'm going to start with you.
I think first we have to be very careful to differentiate between those who are older and those who are socially designated as elder, because they're not the same. So to be an elder isn't just an aging of the body. There is an achieved, recognized status, which you have walked along and developed and usually grown. So in the capital E, elder, it's usually associated with wisdom. So I was very mindful for the work that I'm doing currently, the traditional work that I'm doing. My indigenous healer is almost 80 years old. And I was clear that I needed her to have lived a lot more than I had. I have lived a lot, both on the dark and the bright sides of the human journey. And one of the things that I learned from her, which is interesting because I've been doing more, I've spent more years working on my healing than I was actually in trauma. She reminded me of the wisdom of the body and things that I had not tended to. And she taught me about the gut microbiome, which, you know, I'd heard about, but it's not really my wheelhouse. And through her indigenous knowledge, as well as she has a great interest in scientific discovery, that's kind of her jam, she actually taught me about how the little bacteria in my gut inform my mood, my cognition, and my behavior. And part of the work I did with her was to get educated on that. That is actually nowhere in the Western lexicon of how you work with a client recovering from trauma, except that we know that trauma encodes in the body. We know it encodes in the nervous system based on polyvagal theory. We know that the vagus nerve has significant impact on subdiaphragmatic levels. And so people who have trauma in the history often have major digestive issues. I'm 50 years old. I've had digestive issues my whole life. I just lived with it. I didn't know there was a fix because in the traditions that I had explored, it's not even talked about, never mind solutions provided. So this elder, with her other lens, presented something to me that I've been working actively on in the last 3 months, and it's been an absolute game changer in terms of mind-body integration for a physical body that was harmed and beaten and violated. And this morning, before I woke up for this conference, I was tucked in under a warm blanket, wiggling my toes, saying, "Good morning, beloved body of mine." That's healing. Thank you.
We're always up for a good laugh and some entertainment with Jackie. That's why we love her around here. We love your stories and your thoughts. Yes. Lynn, how about you?
I think for me, I agree with what's already been said. Is there's a difference in when we were referring to elder, what we're actually referring to. It's those that have gained that knowledge and have that wisdom within that specific community. And I think it's important to also recognize that when you identify an elder within that community, you can't just assume that, like, hey, this person's going to give me all that knowledge and they're going to tell me everything that I need to know to go integrate it in my practice. And really having that understanding that it's going to be a process and that you have to essentially build that connection with that elder, and really have that understanding that these are the things that I'm like looking for to help that client through their journey of healing. I think it's also important to incorporate some of the community healing as well. Each community will have its own kind of system that it does for healing, especially after traumatic events that affect the community overall. And also, a lot of the Indigenous communities have that intergenerational trauma that's been passed down through those generations, really understanding how has the community overall as a whole dealt with that trauma, and how have they've kind of taken some of those steps to try and heal from some of that trauma.
Thank you. Thank you. Krista.
I am so digging this panel. This is so much fun. And that's, what I want to speak to is the idea of community. Even in like on a panel like this, like we are a tiny community, and what I'm really, really loving these days is the healing that's taking place in small groups of like-minded people who are sharing experiences, and all of the power in witnessing. And being witnessed, and witnessing each other, like that is so powerful and so needed and so healing. Sharing, witnessing by like-minded folks in community, these and not like communities you might think of. Doesn't have to be geographic or ethnic or racial lines or even age groups. I think one of the benefits of all of this virtual gathering is that we've learned how to reach across and connect through these, through the airway like this, and through the internet, and to be witnessed and to share and to be vulnerable is so incredibly healing. So I love this form, this the power of the collective. And people are throwing around words like collective leadership and collective healing and collaborative work in new ways, not just working together, but really living and healing each other this way. Yeah, I'll stop there.
Oh, absolutely. And I agree. And I love, that's one positive thing, Vlad's, that we're ready to go back live. However, the virtual platform, and that this has given us the ability to really connect across, like you said, everywhere, anywhere that has internet coverage and electricity, because I didn't have electricity an hour ago. That gives us the ability to connect at a different level and a different pace. So yeah, absolutely. Azaad, how about you? What would you like to add to this?
I think this question could take us the whole day of discussion, and I think we'd enjoy it. So I'm just going to respond with what's coming to me, because I really can't do anything else but that. But it's making me think of all the influences and connections that guide me through my day and guide me through my practice, and I think referred to teachings, for example, of my grandmother, and who died when I was 13, and I've had a relationship with my grandmother, which is much longer and deeper after she passed than when she was alive. So I literally have more memories of interaction with my grandmother after she passed, and more connection, because we have an ongoing relationship that I think has guided me many times with my awareness, and maybe most often without my awareness, until I come back and say, oh yeah, that was my mamaji, that was my grandmother, who's doing that, and I'm developing that relationship with my father, who passed away 5 years ago, and came to me just a few days ago. My sons were going on their first flight on their own. They're 13 and 14, and so part of me had this fear of, you know, sending my kids on an airplane without their parents. And of course, your worst fears come to mind, as unlikely as they are. And my father just came to me, and he put his hand on me, and it's unmistakable. Mm-hmm. I know what my father's hand feels like when he puts it on my head. There's no questioning that. And said, we're okay. I'm taking your kids, and we're gonna have a good time. You know, and that brought healing to me. Okay, and it allowed me to continue with carrying on with the other aspects of life. And so you know, those are the connections that I think that keep me going. But you know, as referred to already, I've had other gurus through my training, and I continue to refer to them, people who work in psychiatry who have inspired me to do this kind of work. Lawrence Kermayer, for example, who is considered sort of the guru of cultural psychiatry, and has really you know, and he represents many others, I think, but are actively changing the face of psychiatry and trying to change the mainstream of psychiatry. And these are sources of inspiration in the communities that we form to try to continue to do good work when there are many other not so good things happening in the world.
Absolutely. Thank you, Azaad. Speaking of mental health and trends, since we were talking about what COVID has enabled us to do, to be all online and jump on the Zoom trend, we'll say, have you seen any trends in your particular practice, either the psychological field, the self-healing field, or research or practices related to the healing method? So any trends that you're seeing that's happening that either you can tell people steer clear from and why, or that yes, and you feel it's a value and it should stay. So I'm going to go back to you, Azaad, first. I'm going to go backwards.
Sure, certainly, and yeah, I think in some ways psychiatry is going backwards. There's a very disturbing trend where the field is, you know, trying to be more scientific and heavily biological, and really I think missing what is true about health and healing. Which goes beyond looking at neurochemicals. Of course, our neurochemistry is important. We need to understand it. We need to understand the brain as best we can. But there is a trend in many training programs, particularly American training programs. It's now, as Canada does, we tend to follow that we're you know, leaving out important things, including saying, well, we don't really need to train our psychiatrists in psychotherapy that much, because, you know, psychologists do it better, and I think that's probably true, yeah. But at the same time, you know, it leaves out a great deal of understanding of the people we're actually trying to help. So for me, that's a very concerning kind of trend, and I think there, as I alluded to in my previous response, there is you know, a substantial group of people who are actively trying to help people see things from a more broad and pluralistic perspective. I think the other trend that I'm concerned about, and I think there are positive aspects in this as well, but is the exportation of Western psychiatry and psychology around the world. I'm also involved in some global health projects, and you know, this type of technology has made that much more possible in the last couple of years, which has been a blessing. but at the same time, you know, we still come from a bit of a, not a bit of a very colonial kind of background, including how we've developed our practices and in medicine and psychiatry, and so we're now taking that and saying, now we're going to help the world with mental health, but we want you to do it our way. Okay, we want you to see it through our lens. Okay, and look, we even have a book for it. It's called the DSM, and you know, we should all adopt that, and we're going to do great things for you. And so by bringing you all this knowledge, and I have some concerns about how we are going about that, and in a recolonialization and re-traumatizing way to others, rather than a more balanced knowledge sharing point of view. Thank you.
Thank you so much. I felt a lot of head shaking, and I'm definitely head shaking around that, like that we know it all, we know it best type of mentality, and it's sickening. So I appreciate you being open and honest about that. Krista, how about you?
Yeah. Well, as I mentioned, like in the last round, I found that exchanges in small groups and even like breakout rooms in a large virtual gathering are places where profound healing can take place. You know, we're talking about trends, like what do I see happening now? What seems to be like, things that are kind of new and are taking hold. I'm finding that we're thinking more about collective leadership, and how to leverage the healing power of community. One of the things that I'm seeing, and it touches on something Azaad was just talking about, is that working with women, especially Black and Indigenous women of color, we talk about decolonizing definitions of beauty. We practice some mindful awareness around body shaming, right? And we talk about decolonizing time by encouraging the importance of rest. Like it's like not a matter of just like do how productive can I be all day, but like am I just taking time for myself? Can I take a break? Am I allowed to take a break? I mean, we have this feeling that like we're getting away with something if we rest, that we're actually not worthy of that. So I see that as a trend. We're talking about decolonizing self-worth by highlighting the value of self-care. And I find that to be so healing, especially when we bring something like bathing to like a ceremonial or sacred state, just the regular hygiene. Now, like the act of taking a shower, I can talk to water, I can be grateful to water, I can have reverence for water and my body, and I can make this a ceremonial practice. These trends I celebrate and applaud, and I welcome, and I bring them into myself and love to share.
Yeah. Thank you, Krista. How about you, Lynn?
Yes, I think I've noticed specifically in the practice fields is that for my area anyway, that there's been an increase in the number of American Indian and First Nation Aboriginals into the field of psychology, which I think is important in a lot of different aspects that have already been mentioned here, and that a lot of the scientific basis is very Western based and having that one specific view. So, programs like the Indians into Psychology doctoral education program, which is really aimed at increasing the number of Indigenous people into the field, helps kind of bridge that gap and really join together different perspectives and saying like, hey, that there is more than one scientific approach to healing, and that we can look at this from different angles. And, prior to the 1990s, a lot of that didn't exist. And I think that's really important to acknowledge that we need those diverse opinions related to spirituality and healing to be incorporated and taken into consideration. I think another topic that I've noticed is that the emergence of tribal IRBs for research purposes, and the importance of those tribal communities really being participatory actions within that research to ensure that there's mutual benefits, especially with the long history of a lot of research going in without the community's consent and using them for their own personal gains, instead shifting more towards mutual benefits and having that specific community allow their own spiritual beliefs and customs to be taken into consideration and to be shown the effectiveness of those beliefs and practices through that scientific lens.
Wow. Yes, absolutely. Thank you, Lynn. Jackie, and you?
I want to distinguish between the field of psychology and the subspecialization of traumatology, where things are a little bit more hopeful. So I will speak on that. In necessity is the mother of invention. And in the field of traumatology, when you're working with clients who have usually a minimum of 3 concurrent diagnoses, quite often 5 or 6 is very common. There just aren't enough tools to put out all the fires that are burning. So traumatologists are always looking for what else can help us. And what's emerged is the field of psychedelics. There's been a revival of psychedelic research in the traumatology field, led by Bessel van der Kolk and colleagues. There's some really beautiful stuff that's coming out of it. What's interesting for me is, I'll talk about this tomorrow in my presentation, but 15 years ago, I had the opportunity to go to the Peruvian Amazon and spend 9 days doing ayahuasca ceremonies. Far and away, it was the most powerful healing experience of my existence. And ayahuasca is a form of psychedelic. It's one of the things that's being explored now. So now, in the last 2 years, I'm hearing conversations in trauma conferences about the medicine. The language that's being used is the medicine. So psychiatrists and psychologists, even though they are not really focused on psychospirituality like we are starting to move in the direction of mystery and spirituality, because that's actually where the research is taking them. The other exciting development, it's been really 10, 15 years that I've been seeing this emerge, is the return to the body. Our profession started very, Freud, Jung, Adler talk therapy, meaning, existential, reframing, all that jazz. Beautiful stuff, rich stuff. Not enough. It's necessary. It's just not sufficient. So what we have found now in the last 15 years, especially with the work of Stephen Porges's polyvagal theory, is all trauma encodes in the body first. All activation of trauma starts in the body first. It's actually a bottom-up process. So you can do all the talk therapy in the world you want, by all means do it, but you cannot exclude going back to the body to clear what is located there. And more, that is considered best practice in the field of traumatology.
Thank you, Jackie. All right, let's ask a question about working with indigenous communities, or even maybe certain religious-based communities, because this was a question that was posed in the chat. So how does one, maybe that works in some way healing, either traditional, scientific, or self-healing, I guess not necessarily self, but traditional or scientific, how does one approach someone who's outside of their own community, so that maybe they're not indigenous themselves, or they're not that particular religion, especially with the access, like you were talking, Azaad, about, we're trying to force it down. We see this trend of forcing the Western way down people's throats. How would you advise those that are trying to work either with different cultures, indigenous, different religions, how to approach working with them to support their well-being the best way possible? So this could be tips. This could be something, even a resource. And I'm going to go to you, Krista, first. On a spiritual side, how can we support someone who maybe is, comes from a different background?
Well, I'll answer the question just based on a recent experience I had with a client. I was offering grief processing support, and she was not a member of my ethnic or racial community, and she was grieving the loss of her grandmother, who was not, she and her grandmother even had a difference in practice, in spiritual and religious practice, while they were both in the same ethnic community. So what was important for me was to begin with listening and dialogue and understanding what her beliefs were. What I've found is that for many people, one of the blocks to creating change in their life has a lot to do with a feeling of self-worth, of like worthiness. Am I worthy of feeling better? Can I have happiness in my life right now when I am so unworthy because of guilt or shame? And so talking with her about her belief, about her own spirituality, her own practice, her own makeup in her family, and with her grandmother, who she'd recently lost, was what I use as a guide for how to best help her with her grief support. So it has very little to do with me, and everything to do with the people that I'm working with, and what's going to work, what's going to be easiest for them, and provide the easy access to self-healing, right? I hope I've answered that in a way that was clear. And that's how I work with my clients. It's really just starting with them, where they are, right at this moment, and what they can access, and going from there. Yeah.
Thank you. How about you, Lynn?
Yeah, I think for something that I've kind of learned along the way, going into different tribal communities, is that really building that relationship with the community, because essentially, they don't know who you are, and really having that rapport with the community is how you're going to have that relationship to understand what are some of their traditional and cultural practices and beliefs, and how can you get that knowledge to be able to bring that into sessions with you, as well as like I said earlier, the person is the expert of themselves, and having them also kind of shape like what are their spiritual and traditional beliefs, and how important and how much do they practice those, I think are really important things to take into consideration, because even if that person says like, yeah, I'm traditional, they might not practice as much traditional practices as you would expect, and really meeting them where they're at in that process.
Thank you, Lynn. Jackie.
As a clinician, I actually approach this first from the place in my own life of cherishing all religions, delighting in all religions. I'm always interested to hear about other rituals of other faiths, the music, which I love across the faiths. We need to distinguish between when psychospiritual interventions are necessary or appropriate in a therapeutic journey and when they're not. Quite often they're not needed. CBT works for a lot of people across the board, depending on the issue that you're talking about. And then it doesn't work for anybody across the board, depending on the issue that you're talking about. So I'll give you an example of a Muslim client of mine who I absolutely adore. Now, I was raised a Catholic, just so you know. And she's an Orthodox Muslim, prayer 5 times a day. Work was getting in the way. Part of our journey together was, what is getting between you and your prayer time? What happens when you're on your prayer mat and you're so exhausted that you're not actually praying, you're actually doing yoga and pretending to pray because you're not fully present for this sacred connection? And we have those conversations, and she guides me. I have another client who is a Protestant Orthodox Christian. She guides me in terms of the layers of her faith. And as I walk alongside her, and it's very important that the clinician not go in thinking they're a master. Really, we're not in complex trauma anyway, certainly not in terms of the psychospiritual traditions. She guides me, and then I ask questions. What about this? Tell me about that. Have you thought about this? I noticed that. And then together, we actually leverage her spirituality in the direction of her healing. But in all cases, she is leading and I am supporting.
Thank you, Jackie. Azaad.
I'm going to pick up on a few of these things, but I think Krista struck me when she talked about listening. And by far, that is the most important skill that I think I've learned and continue to learn over the course of my career and try to convey to my students is simple, open listening. And I remember my supervisors drumming this into me 20 years ago, going, yeah, of course we're going to listen. Like, what else are you going to do? But really realizing, and I could see the smiles on the your faces because you know what I'm saying here. It takes time to actually truly listen. And the first thing I tell my residents to do, put your pen down when you come and do the consultation, and trust yourself that if you put your pen down and just listen, you will get everything that you need, and it works. So I think that was one important point you made. Lynn, you talked about developing a relationship with the communities. That is so essential. I do a lot of virtual care these days. And the key to that is you can do good virtual care if you appreciate and understand the community that you're working with. If you're just doing it cold and you don't understand the context, you're really missing a great deal, and understanding the culture of the community. And that community can be any community. Culture is not about being brown or some other ethnicity. It's about the local conditions, environments, beliefs, and so forth. There's a tool that we use in psychiatry called the Cultural Formulation. And it's made its way into the DSM, which I think is great. Again, we've been trying to sort of influence this process, and it's a useful practical tool that helps us assess things from a cultural perspective, from a social perspective, from a spiritual perspective. And I won't go through all the details of it in this time, but it really asks us to explore people's identity, how to go about doing that. What do you listen for? What questions might you ask? So for people trying to learn how to delve into this, I found that to be a really good starting point. So if you Google cultural formulation or cultural formulation interview, you'll also find that tool. And it's not about cultural expertise. It's really about that listening and understanding what is it within that community, what is it within that client that is important for them to bring to the table so that you can understand them. Thank you.
Absolutely. Thank you, Azaad. I cannot believe we have to be at our last question. It feels like we literally just started this panel. And so I would love to leave it with last thoughts. Is there anything that we didn't cover that you feel is important? Is there any message that is burning in you that you feel like you need to share? So I'm going to open it up, and I want everybody to just share their last thoughts. And Lynn, I'm going to start with you, and then I'm just going to go around the room.
I think the last kind of comment that I want to make is that, there is no universal approach. There's approaches that work for each individual person and each individual belief and spirituality. And I really think that that's an important takeaway, that you can make your own spiritual beliefs work for you.
Thank you, Lynn. Jackie, how about you?
I would say always follow the call, the inner call, and follow it anywhere it takes you, wherever that is in the world, to the other side of the world, to the Amazon jungle, into a virtual meeting with someone new. That inner information will be the best possible guide of where you need to connect outside in relationship for your healing.
Oh, you guys don't have to be so quick. You have like a full 3 minutes to answer.
Oh.
Well, you can keep talking if you want. We still have a little bit of time.
Yes, I will share that. I actually, when I moved from Toronto to Yellowknife, which was a significant cultural shock, I had some significant struggles adjusting to leaving Toronto behind. I had an argument with my spouse and had a meltdown and told him that I was going to run away to the jungle. I don't know where that came from. Just popped out. I was working in a men's prison at the time, and one day a client walked in with a National Geographic article and said, "You have got to read this." and I opened the magazine, and it was actually an article on ayahuasca. So I read it. The following week, I got a call from a colleague of mine in Toronto that I hadn't heard from in months. And she says, I need to go to Peru. I was like, the rule is 3, right? Ping, ping, ping. I need to run away to the jungle. Ayahuasca's in the jungle and somebody's on their way to Peru. I hung up the phone. I said to my husband, there is something going on in Peru and I need to be there. I bought plane tickets. I was in the Amazon jungle 14 days later for one of the most transformative psychospiritual healings of my life. That's what the call looks like. But sometimes it's intense, sometimes it's radical. And sometimes people say, why do you want to go to the Amazon jungle? It's on the other side of the world. I was actually up all far in the Canadian North. I went all the way to the south and I stayed there and I did that work. And then the healing that came out of it, I'll talk about it a little more tomorrow, has been with me. I received 3 gifts from that experience that are still with me 15 years later. And I draw on those gifts every single morning as part of my work and part of my grounding and part of my connection to my soul. So follow the call, even if it takes you into the darkness, even if it takes you into the brambles, even if it takes you into the mountains. That is absolutely the key.
Love that. Lynn, did you want to add anything to your last thoughts before I move on to Azaad and Krista?
Yeah, just adding that, spirituality is so broad that it's really important to figure it out and how you identify spiritually, and also being cognizant of how that's playing a part in your day-to-day practices with your clients that you're seeing, and making sure that that it's really their journey through that healing process. Yeah, that's all I'm doing.
Awesome. Thank you, Lynn. Azaad.
These comments are making me sort of think of things that are sort of popping into my head, and one of them is physician, heal thyself. And so much of this panel, I'm hearing people talking about their own, spiritual journeys, not necessarily like other people's spiritual journeys, or our clients, and it just reminds me of how critically important that is to help others and to be able to help yourself first. Jackie, you commented on this incredible sort of journey and listening to the universe and what it is, where it is taking you, because it knows. And that is hard. Like, it's way easier for me to say that than to actually follow it. Right. And one of the people I've followed and I keep rereading is Eckhart Tolle. And particularly a New Earth. If you're gonna choose something to look at, it's been powerfully impactful for me, and is over and over again. And I'm always surprised every time I listen to it again. It always feels like I'm reading it again. For the first time, and so that's been a significant influence, I think. And there are a couple of other sources. I just pulled this off the shelf because what you were saying reminded me of this book. It's less well known. It's called They Call Me Gabriel. It's a book on spirituality, but it really is about connecting with the universe, connecting with ancestors, how different communities might relate to each other in a pluralistic way. And I think that has also had a significant impact, or continues to have a significant impact on how I try to develop myself. But it is an up and down journey, and I've been at points where I'm feeling connected and spiritual, and not very long ago, maybe days ago, I felt totally disconnected. and, you know, and totally low, and not just feeling completely lost. And so this is I think this is a continuous struggle in life. And I think, you know, I'm blessed to be part of this forum to even bring me back into that space. So I thank you all very much for that.
Thank you, Azaad. And Krista, bring us home.
No pressure. Yeah, I think what Azaad was just talking about, Pema Chandran, the Tibetan nun, talks about being a spiritual entity having a human experience, and that you know, that bliss and despair and alternating, you know, the vicissitudes of life are part of the human experience. I would say that healing, especially from trauma, and thank you, Jackie, for bringing trauma to this discussion, it is now, you know, maybe I could say it's understood, or at least it's talked about as having universal, ancestral, generational threads. And we don't have to have direct experience with trauma, with a traumatic event, to know its impact. So people are grieving the loss of planetary species. You know, people are grieving deforestation and the loss of access to clean water. I mean, there's so much grief, right? So much trauma in that way. Young people are expressing anxiety and depression at you know, larger numbers and more often. I'm hearing from therapists. I'm now a member of a new group here in Philadelphia that's just forming, the Philadelphia Eco Therapists Collaborative, and we were just talking about the rates of suicide. And so I'm thinking if healing can be seen as something that's nourishing and connects you to a feeling of belonging and well-being, it's something we mentioned at the top of the hour of the panel, then we could start with that awareness, right? And I would call that grounding, you know, this idea of being nourished. And there are many ways of achieving groundedness. And one technique I like to mention here is to be with the ground, right? Sometimes we call this earthing, you know, having a human experience on earth and doing some earthing by placing your bare feet or your hands on the ground and laying down on the ground. But as simple as that sounds, when you live in an urban jungle where there's no clean ground to lay on, you can't place your body on that. It's easier said than done. Or if you're in a climate that, you know, where the cold doesn't permit you to comfortably touch the ground, holding a rock or a crystal can work to ground you. And if there's no accessible ground, no rocks, no crystals, using the imagination, and this is where we get into the shamanic work of using the imagination. Yes, beautiful quartz crystal nearby. Thank you, Jackie. Imagination. So, you know, imagine being in a place where you can place your bare feet in the sand or on the ground or in the grass, or, you know, begin to feel the cool dampness of soil. Using your imagination, take your time and feel the success and the victory of being grounded. I feel that victories are like this, are the spiritual rocket fuel propelling the space travel of healing.
Chicken skin. Wow. I'm not often a loss for words, and this is definitely a loss for words. First of all, thank you all so much, not just for showing up and saying yes, but for your presence and for everything that you're doing for our world, our community, and yeah, for generations to come. So thank you all. For those of you who really connected, please, if you're on the Hoova app, message our panelists. This was a phenomenal panel. I'm really proud of myself. I actually held in like some of the tears until the end. I'm probably going to have a glass of wine and maybe a bit of a cry afterwards. In a good way. In a good way. By the way, I'm in Bangkok. It's 10:30 at night here. It's not the middle of the morning. judging. Anyway, but for those of you who really connected with our panelists, please, 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 please connect with them connected with them emotionally, spiritually, energetically, connect with them on either the Hoova app if you're part of our platform. If not, and you're watching this live, please make messages in the Facebook live feed, and our panelists connect with them on their platforms, either Facebook, Instagram, whatnot. Panelists, please make sure you go into the live app and the ICSP live and put your contact information in there for everybody who wants to connect with you. Take this information and go be forth and go forward. And everyone, you know, I know from my own experience, and actually tomorrow makes 20 years that I had my cancer surgery, that all of these three play the healing methods play I told you, a loss for words, play a very instrumental part in all of our lives, regardless of our beliefs. It's just if we're choosing to be present, and the profound change that can happen when we really become our own advocate and use all of them to our own benefit and use them as the tools for us in order to go through whatever we need to go through. So thank you again for everybody who tuned in. Thank you, panelists, again so much for your wisdom and your stories. And I feel like this could have went on forever. So thank you. All right, everybody, see you tomorrow at our last panel.
Thank you so much.
Thank you.